in California, so there was literally smoke in the air, but I don't think that's why I ate late.
Oh no. You may hear pounding in the background, and I think it's my neighbors beneath me are pounding their wall.
Oh dear.
Yeah, I can feel it.
I think that's probably going to bother you more than it bothers everyone else here.
No, that's good. I never cared about myself that much anyway. No, I love myself very dearly.
Good.
They are loud. Oh my god.
Oh no. I can't hear it.
That's good.
Okay, ready to start?
Let me put that bag out of the way. There we go. Now I'm not. I don't have any influence in eating.
All right, bringing the bots in.
Now recording.
Now recording. I did that better an hour ago. Now recording. Nah, I can't do it right now. I don't know what's up with my throat. So how's voice stuff going for you?
It's going all right. I wish I was able to put more time into it, but I actually got a job just this week. I had to go through a lot of pay processing. But,
Oh, is that a good thing? Is that exciting? It
yeah,
sounds
it's a student worker job, so it's part of the university,
okay.
which gives me access
Oh,
to
nice.
a free Adobe now. I get the Adobe Suite.
Ooh, that's fun.
Yeah, but during like in between, I keep doing the exercise that we kind of like hammered the last time we talked 2 weeks ago.
Hmm.
Um, but yeah, the reason I wanted to do another session was because I'm not really familiar with a lot of the exercises, and I don't like. It's like I don't know what they're exactly affecting, and performing them feels a bit awkward because I don't know if I'm doing it correctly or not. So if we can go over
Right.
some of that stuff and maybe kind of give me the thumbs up that I'm doing it right, that might give me like the the a okay to keep doing it more.
Yeah, absolutely. Yeah, what should we tackle first?
Um, so I guess one of the ones I guess it's something like the one we were like we were doing last time, where I would it's like the whisper slide, I guess, but it's always
Oh,
followed up. They call it something else, but it always falls with like trying to talk afterwards, and I don't
oh
know
yeah.
if it's meant to be like if you talk like when you talk you're supposed to like drop down really hard because that's what it feels like with me. It just
Mm.
doesn't really seem like it does anything. Um,
Okay. Okay.
yeah, that's one of the big ones that I keep having a an issue with. So I'm not sure if I'm even doing it right. Um, trying to remember
Okay.
another one to pull up real quick. Mm-mm. Uh, I think it's similar, but it's like it's a weird like you just go like from your like lowest point, I guess, up by doing pop pop like pop pop pop
Oh
pop pop
yeah.
pop pop pop. Yeah, something like that. It. I think we talked about that. It's not like one of those like semi. I can't remember what it's called, but we have it in my notes here.
Oh, semi-occluded vocal tract
Yeah,
exercise.
isn't that what that one deals with? Since it's more of a, it's like soft spoken, really.
Um, Not exactly. Like I mean it literally is like occluding the vocal tract, but it isn't what a semi-occluded vocal tract exercise is. That
Okay,
that phrase refers to a very specific thing.
gotcha.
Um, so the that pa exercise, like I usually describe it with the terms that Ziana describes it with, which is like lightly aspirated P sounds. Um,
Okay,
and that's an OPC exercise. Um,
OPC. Okay.
yeah, hopping on um, video. Um, so Da, 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 da. Trying to think. Where to start with this stuff. I guess really brief explanation of OPC. Are you familiar with OPC?
No, I'm not familiar with that one. It,
Okay.
yeah.
So I guess like trans voice basics. Um, we want to uh, so testosterone does basically four things to the voice. It increases throat space, it increases mouth space,
Yeah.
it lengthens the vocal folds, decreasing pitch, and it thickens the vocal folds. So with respect to throat space specifically, excuse me, we want to do two things.
Yeah.
We want to do like really like a bunch of different things, but basically two things is uh, at the bottom of our throat space is the larynx. When the larynx is low, then it increases throat space because it lowers the floor of the larynx. And when the larynx is high, it decreases throat space because it raises the floor of the larynx. So the whisper slide is partly to induce the larynx to rise, to decrease that space.
Yeah.
And then OPC is about taking the back wall of your throat and pulling it forwards in order to reduce throat space from the back.
Okay.
And the term OPC is kind of a medical term. It's oropharyngeal constriction. Oro refers to your oral cavity. Pharyngeal refers to your pharynx, which is your throat.
Yeah.
And constriction refers to make it smaller. So oropharyngeal constriction, what it actually is just taking the back wall of the throat and pulling it forwards.
Okay.
So the reason that we do this, the reason that we use P sounds is because the pitch of the P sounds is affected by the space behind your lips, basically. So when I do lightly aspirated P sounds, you will see my larynx move.
Okay.
But what you cannot see is that the back wall of my throat is also moving forwards. So if I do this again, but show you what's happening in the back of my throat, or like an approximation, because I don't have like the measuring tools, but basically what's happening is
Okay, I get you.
cool.
So doing whatever that exercise is called, I'm not really sure still. That would help.
sound.
Yeah, the P sound exercise, which sounds really weird. Okay.
Well, okay, we can call it the pa-pa-pa exercise.
All right,
I
pop
kinda like
up.
that.
There we go. That's
The po-pa-pa exercise.
So that would
Po-pa-pa.
help kind of like just kind of like help me just keep the throat space smaller then. So that's good.
Yep.
Now would I like after doing some exercise, I guess after a while, like would that just be like that's just a now natural thing if I try talking after doing it and such? Because I don't know what point, like what will be the point where like I don't need to exercise and my voice is just my voice, you know? Like I guess it's
Right.
a long time ahead of me, but I don't know. I feel, yeah.
It varies from person to person. So effectively what we're doing here is I need to think of more metaphors for this, but the idea is that when you're doing the exercise, you're primarily moving like one particular muscle or like one group of muscles or whatever.
Yeah.
And the more you do that exercise, the more you learn to move that muscle by itself. And eventually, the idea is that you can let go of the exercise and just move the muscle.
Okay.
So it's learning a new muscular coordination. So, like, a few other examples of doing that in day to day life are like learning to ride a bicycle, learning to juggle, learning to walk when you're like a really tiny human.
Yeah.
Things like that, learning to ride a unicycle. So yeah, I think people like learn these things at different speeds, and like everybody's capable of doing it, but for some people it takes less time. For some people it takes more time. But
Okay,
yeah,
so the practicing it will help my muscles kind of basically memorize and get stronger to the point where I can do it on command without the use of them. Which, I mean, I don't think it'd be bad to keep using exercises for like the rest of my life, but it would be nice to like not have to at some point.
yeah, and
Um,
I think you naturally like get to rely on the exercises less and less.
that's good.
Um, yeah,
Uh, and
like right now I'm
oh,
right now I'm learning how to retract my false folds, and like for a while I couldn't do that without like playing with a few different exercises, and now I've kind of got it like down to doing it reliably with one exercise.
yeah.
And that exercise is basically just like exhale while you're retracting and engaging your false folds.
Hmm.
So in order to learn how to do that without the exercise, it's basically learn how to do that while not exhaling, and then literally all I'm doing is moving those muscles. So it doesn't
Oh,
really count as an exercise at that point.
okay.
Um, and that's generally I think what you can expect from these other exercises. Like what I'm doing here, I'm listening to the sound and I'm moving that muscle, but like when I stop doing this and just do um yeah, like moving from doing
Okay.
the exercise to not doing the exercise is just a matter of like stopping doing this,
Gotcha.
which is like yeah, doable, I think.
All right. And I guess the main point of my like curiosity of like where to progress with these lessons and my journey is now like I want to make sure I'm doing like I am doing stuff to make so I can I don't know what the term is, but I think it's the R2 whatever it is, the one that changes the gender, basically the
Right,
feminization.
yeah.
So I I obviously don't know a lot, and I've been trying during my free time to look at Ziana's stuff, and I've gone through a little bit. I think I started her like art of feminization, like one. I was going through that. It's a lot of that's just out of my knowledge base.
It's pretty dense. Yeah.
Yeah. So I'm like, okay, I hope
Yeah.
the next video isn't as bad because it's all about raising your larynx. So I was like, okay, I can
Right.
probably digest that one a bit better. So
Yeah. She likes to cram a lot of information into her videos. It's like a calculus textbook or something. It's like
yeah.
it's possible to learn, but it's intimidating at first. And sometimes rewatching it a few times can help.
Yeah, I can already see myself watching these over and over and over on my free time.
Yeah,
Uh,
yeah.
I'm glad I know about her more, so I'm actually getting into these videos. Um,
Yeah.
so I guess so again the question is so the pop-up exercise seems to be like one of the great directions on controlling the larynx, right? Or would there be a
Mm.
different exercise for that? Because I'm doing the whisper slide like almost silently, and it's weird. Like there's points where I'm able to do it pretty decent and like almost fluent, where I don't even need to make it like I don't even need to move almost or make a sound. But then there's times where like I can't do it, no matter how hard I try. I just cannot raise it anymore. It's
Okay.
weird. Um,
Um so there's a few different exercises for it. The whisper slide is like definitely the most like common, the one we talk about the most.
yeah.
The pa exercise does also, for me anyway, it seems to raise the larynx. Um, like all of these are kind of exercises around like making a sound that you can only make if you're doing the thing that you're trying to do. So like pa and like whisper slide are about making those like high sounds, and you're only able to do that if you're raising the larynx.
Yeah.
Um,
And
and
it
like,
yeah.
have you heard of the big dog small dog exercise?
Yes, I believe that's where it's like you got like your like lowest points and you just hop back and forth to your highest, right?
Pretty much, yeah, yeah. So it's exactly the same concept.
Okay, yeah. I do remember. I think I remember that when I was reading Light's guide a while back when I was, I think in my spring semester,
Mm.
before COVID hit, actually.
Right, right.
Yeah. So that's good to know then. So if I'm doing like the whisper slide, like I'm gonna be like a bit more vocal about because I'm trying to like be more silent so I don't hurt my throat as much. But so it's basically it sounds like this, right? Like, right? Or is it more like, oh god, I don't know. Every time I do it, I keep getting phlegm, and it's really bothering me because it like I think I'm doing it too much, and I don't know how to stop doing that.
Right. So there are some subtleties that you can play around with. So first of all, you can get a certain amount of height by raising your larynx, but you can get higher if you add OPC to the mix. So if I only raise my larynx, then I can get about this high. But then if I add OPC, then I can get higher, and like more feminine. So again, that's
Okay. All right. So I think my goal is then like keep practicing the whisper slide or looking into the small dog big dog because now I'm kind of curious about that one a bit more.
so small dog, big dog is like normally I use it as like an introductory larynx raising exercise, and then like I do whisper slides second because it's like a little bit more abstract. But
okay.
If you haven't played with small dog, big dog, then it's definitely worth playing with because it is just like another way of looking at the problem. So
Yeah, and I
that one.
Oh, sorry.
So that one is just like.
Okay. Oh god, why can't I do it now? So like that, pretty much. Okay.
Pretty much, yeah.
All right, cool. That one doesn't seem too bad actually, because it seems like I can hit that one a bit more consistent. While like the whisper slide ends up where like, again, going. I guess there's too much constriction or something going on, with the whole phlegm that I get.
Right. Yeah.
I'll keep playing with that, seeing if I'm able to like not have that happen and just get like as close as I can. I'm still trying to figure out what's causing it really.
Mm-hmm.
And you mentioned the whole OPC. I need to like we talked about the pa pa pa, so that should help a lot with closing that in and making less throat space, right?
Yeah.
Okay.
Yeah.
So, is there any other exercises that would be good for that, or is the one we talked about before kind of like the main one for that practice?
So there's a few. So there's the pa pa pa. There's also imitating cartoon voices.
Oh.
I'll post some links in the chat. So 3 cartoon voices that do OPC and also do other things are Elmo, Meatwad, and Gollum or Smeagol.
All right.
So if you like doing cartoon voices, this is like totally a valid way of like getting that muscle memory.
I can play around with it. I never was one to do cartoon voices growing up.
Okay, yeah, I would play around with it. I think for me, this has been like pretty useful.
Yeah.
Just like and pretty fun, really.
Meatwad.
So that's
Oh my god.
that's another one. And then have you heard the expression "hawking a loogie"?
Yeah, I guess. I never heard it as an expression though.
Or yeah, not really an expression. Okay, let me hop on camera again. So the way that hawking a loogie works is basically what you're doing is pulling the back wall of your throat forwards and then like using turbulent air from your throat to like kind of spray the back wall of your throat with air to like dislodge some of the mucus on there. So it involves pulling the back wall of your throat forwards. Therefore, it's an OPC exercise. So
Interesting. All right.
that's an OPC exercise.
Might be a little bit disgusting, but that's fine. All
Yeah,
right.
it's probably the most obnoxious OPC exercise, but it's also one of the most effective ones.
I
Which
wonder
is
if that's
I'm
why my
mentioning
friend
it.
does that all the time. Then.
Oh,
I hear them doing that so much. Like they do it throughout the day. So maybe that's why. Well, I now learned something I never thought I'd ever connect. Wow. I'll give that
Yeah,
one a
like-
try, definitely.
yeah, like if you join them, then that's practice that you can do every day, pretty invisibly. And I'm always a fan of like exercises that you can do like before you even come out. I don't know what your situation is.
I'm
but...
out. Yeah, I'm out.
Okay.
I moved out as well,
Good.
so I'm on my own, sharing a place with a roommate.
Nice.
Yeah,
Excuse me.
yeah actually, this is my third month on HRT, by the way.
Congratulations.
Thank you. Yeah, it's actually well, I'm waiting for the results right now since I just got I got my blood drawn the other day. Yeah.
Nice. Have you seen any effects yet?
Yes.
Yay.
I have definitely have experienced a lot of sensitivity and just itchiness overall.
Okay.
But one of the things I didn't expect to happen so early on was I am very volatile like with my emotions now. It seems like and it's not like a bad thing. It's more like I want to start crying about things I shouldn't cry about, and it's just like that's never been me.
Right. Yeah. Yeah. I wouldn't say that I've experienced like stuff to that degree, but just like testosterone mutes feelings, and it's so nice to have my feelings off of mute. But then, yeah, crying is a thing.
Yep, and there's other effects that I shouldn't go over about in a public call, so I'll you get the idea. So yeah.
Good to hear that you're experiencing them.
Yeah.
Cool. That's exciting. Okay, so yeah, so that's 3 OPC exercises. So pa 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 and hawking a loogie and cartoon voices.
Cartoon voices, yeah. Which that'd probably be like the most fun to do because like that can be like whatever I want to say and try to imitate.
Yeah.
It. So
Yeah, like I will often just like switch into a cartoon voice and like talk around there for a while, like including during lessons. Like sometimes, like especially when I'm talking about Stitch voice, well, it's really fun to talk using Stitch voice. So I'll just like talk like this for like a while during a lesson and like forget that I'm doing it.
Stitch. Oh no. I used to
Yeah.
love that movie. All right, so
Such a good movie.
it's
Yeah,
with
Stitch isn't really useful for voice feminization.
Ah.
It's more,
Okay.
unfortunately, like Stitch voice is a quality that can like happen to some trans women when they try to reduce like all the throat space, because Stitch voice happens when your tongue gets like too far up and back, in like a really specific way. So it's not like bad to do Stitch voice, but yeah, doing Stitch voice won't like help you. But it is fun, and like that, yeah, there's no reason not to, but yeah, there's no reason to as well.
It's fun, you know.
But yeah, that's why it comes up in lessons, because a surprising amount of people like do Stitch voice unintentionally, which is really interesting.
Oh, okay. I'll keep that in mind if I start sounding like Stitch all of a sudden.
Yeah.
Moana.
Okay. Um, so that's 3 OPC exercises, and then also Whisper Siren or Whisper Slide and Big Dog Small Dog. You can actually go higher with them when you do OPC, which is really interesting. So something that I'll have a lot of my students do is do the pa 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 exercise and then do a whisper slide right after. And often they'll be able to go higher with the whisper slide right after doing pa pa pa.
Okay, yeah. Pa, 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 pa.
You want to avoid using voice. You don't want to do pa pa pa. You want to do. And for both whisper slide and pa pa pa,
Oh, okay.
there's some vowels that you want to aim for and some vowels you want to avoid.
Oh.
So if you end up with like an E vowel, that's that can be a red herring because it can like sound like you're brightening your voice, but actually you're brightening your mouth space, you're reducing your mouth space, but you're darkening your throat space, you're increasing your throat space.
Okay.
So
yeah.
the reason I say pa 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 or pa 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 is because those are vowels with a high R1, a really small throat space. But which you were doing, actually has a pretty low R1, a pretty big throat space. And E has a pretty low R1, a pretty big throat space. So you want to avoid
Okay. Avoid
and aim for A as in cat or as in umbrella.
Alright, yeah. Okay. Cat. Okay.
Yeah. So like going from to A can be pretty effective.
Okay.
Going from to A can be pretty effective.
And-
To
Yeah, and after doing the pop before just doing like a whisper slide, I was able to hit where I was trying to aim before without any phlegm. So that was useful. That's nice.
Oh,
I'll keep that in mind because I was able to go up. I was able to go up there without hitting any phlegm.
wait, what caused that?
So after doing the pa 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 thing, I was rising up, and then I was just like, I just thought I'll just do a random whisper slide, and I was able to, I could feel like how high I was going with my larynx, and I didn't get any phlegm when I did that.
Nice.
So
Nice.
I'm
That's cool.
I'm keeping that noted down. I'm writing that down to myself right now because that one's important. Because I was struggling. I was like, why do I keep getting this every time? So now I got it. I got that. I have an idea. Thank you.
Cool.
I'm glad you mentioned that because I would never tried it otherwise.
Cool. I don't know what I did, but I'm glad it helped.
You mentioned how you sometimes have your students do the pa 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 before doing a slide.
yeah.
So I was just like, I'll try it.
Yeah. Yeah, that's interesting. I don't see why that would reduce phlegm, but I'm glad that it does.
It might be just something with me because of my throat.
Yeah, it might be like a quirk.
Yeah.
But yeah, the reason I have them do like pa 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 then whisper slide is because it lets them go higher with the whisper slide than just doing whisper slide by itself.
Yeah, which that's good to know too. All right.
Yeah. Cool. Trying to remember what other things you brought up. Or do you have any questions about anything we've talked about so far?
So far, I think it seems pretty simple now, or at least more straightforward than it was before. So that's good.
Okay.
Yeah, because I'm also like on top of like our lessons, I'm also watching Xana and trying to like figure out what the hell she's like telling me. Because a lot of times it's just like I don't know, but I'll look at it later.
Okay. Yeah, let me know if you have any questions about Xana stuff as well.
Yeah, definitely. I'm getting to her like more newer stuff, which seems to be a bit more simpler. It seems. I actually like. I had to check it out because I was really curious about how to hear yourself. By doing that, I think it's have helped me tremendously on actually knowing if I'm making a difference in my voice now.
Yeah,
So
yeah.
I'm happy to know that one.
Yeah. Cool little hack If you record yourself and then play it backwards, that can be a good way of like of helping you to not recognize your voice, which then lets you like evaluate it more objectively. Because like it's easier for me anyway to like judge other people's voices than to judge my own voice.
Yeah.
And like listening to a recording, like even if I'm listening to recordings of other people's voices and recording of my own voice, but if I'm listening to a recording of myself backwards, then it makes it like a little bit more unfamiliar, which helps me to like evaluate my voice more effectively, which is really interesting.
Okay.
Yeah, that how to hear yourself trick is also really cool.
I was so thrown away by it because I never would have thought about how I don't actually hear myself like everyone else does, and how even recording doesn't even work like fully accurate. It's so weird. It's like it should, like, I'm hearing my voice. Why is it not accurate?
Right, yeah. So the answer to that is because sound like resonates in your bones, basically. So it's kind of like when you like flick a wine glass and it starts raining for a while. The same thing happens with basically every substance on Earth. Like if with like something like a cymbal, it's like more obvious, like that thing is like rattling and it's making a sound.
Yeah.
When you're flicking like any cup, it's like a little bit more obvious. It's less obvious with like, I don't know, a board of wood or something. But yeah, with your bones, I believe your bones will generally like amplify lower frequencies, which is why our voices sound deeper inside of our own heads.
Yeah.
And also why our voices sound like, I think our voices sound softer in our own heads as a result. And they sound like kind of harder, harsher when we listen to recordings of them. So that's another part of why people don't like recordings of themselves.
Well, I do know one thing at least. With this microphone I got not too long ago, I actually enjoy this to myself, because in the past I used to not like it because it never sound anywhere near where I hear myself. So
that makes sense.
This has helped me a bit better. It was a bit pricey though, but I like Technical. It seems to be a good brand.
What kind did you get?
It is a Technical Pro 20 Audio Technica 2085, I think. I can't remember the number.
Okay.
Yeah, it's a condensed microphone, so I got an XLR cable and a mixer here. So
nice.
nothing too advanced on the mixer. I went cheap on that because it's like I don't really care about the microphone itself.
Right, yeah.
Yeah, and that should also save me money on buying hundreds upon hundreds of headsets now, because all I need is the actual headphones and not the mic part, because every mic I got on headsets would always break on the week I get it.
Oh, yeah. Also, mics on headsets are generally like really bad quality.
Yeah, they were really bad.
Yeah, that's cool. I want to get a fancy microphone at some point. Like, so far I've just been using like the microphone on the iPad that I'm talking to you on,
which is surprisingly good.
Which is like pretty good,
yeah.
But not like professional microphone quality.
Yeah. All right. Awesome.
Does anybody listening to the lesson have any questions? You can type questions at any time in event text chat. So think of questions so that I can answer them. So are you familiar with like what R1 is? Like why we talk about R1? Like what is the one? Are you familiar with like that stuff?
I always get mixed up with R1 and R2 because I can't remember, but I know one's supposed to be like throat space specifically, and one's like mouth space. Is that correct?
Yeah, that's correct. Yeah. Okay, let me point my camera at my look at my spectrogram. The reason that throat space is R1 and mouth space is R2.
Gotcha.
Throat space is bigger and mouth space is smaller, and that's basically why throat space is R1 and mouth space is R2. Because the smaller a space, the higher it'll show up. The bigger a space, the lower it'll show up. So, excuse me. If I do a whisper slide from low to high, then I'm taking my throat space and mouth space and bringing them from big to small. So as I was doing that, I was taking my throat space and mouth space and bringing them from big to small. And this line here is my R1. This line is throat space. And this line right above it is mouth space. It's R2. So, and then if I go from small to big, then I'm these lines are going downwards. Heck, let me press the pause button. Thank you. So the reason that they're numbered like that is because they're counted from the bottom. So, or like, shh. It's kind of like there's a bunch of blobs here.
Yeah.
So it's hard to say what's number one and what's number two and what's just like noise from the spectrogram not quite working right, and things like that.
Yeah, I've always had difficulty reading those. Even with Ziana, like going through on our first episodes, it's always like I don't know what exactly I'm looking at.
Yeah, for sure. So to help with that, my friend L something came up with a heuristic, which is the spectrogram donut or the resonance donut, whatever you want to call it. And that's when we whisper a gradual slide between as in umbrella, E as in eat, and then as in umbrella again. So the reason that we do is because it's basically the average vowel in the English language. So like when you're inhaling, you're probably inhaling on an vowel. And so learning how to, so there's me inhaling on an vowel. And the cool thing about learning how to read this is when you're listening to cis women on like TV shows and podcasts and stuff like that, if you look at a spectrogram and you know how to measure their then you can also measure their R1 and their R2. You can measure their throat space and their mouth space. So if you have like a goal voice or like an inspiration voice, like someone whose voice you want to like know how to replicate, or at least you want to sound them like them or something like that.
Yeah.
You can look for the and with enough practice you can use it to measure their throat space, so you know what targets to aim for in terms of throat space. So the way that we learn how to interpret this is by adding the E vowel, because right now this is kind of a blob and R1 is in there somewhere, R2 is in there somewhere, but it's not really clear where they are. But if we go then R2 goes up, mouth space goes up, or rather mouth space decreases, which makes the blob go up, and R1 goes down, so throat space increases. So we see this blob here, and the top half of the donut is R2 and the bottom half is R1, because again we're counting from the bottom. R1 is the first blob. And this is like spectrogram noise, so we're ignoring it. So this isn't actually R1. This is R1. And that can be kind of confusing, which is why we use the donut. So
okay.
My R1 on this it's so sometimes it can be hard to measure. Like here, it looks kind of like I have 3 blobs. So I am gonna fudge this a little bit, and that's kind of inherent to like using spectrograms. Like it's a big bunch of fuzzy blobs, but we can make some educated guesses. So I'm just gonna assume it's like the bottom of these 3 blobs, and that this middle one is like spectrogram noise. So if I make that assumption, then my R1 ends up at about 1100 hertz. So to give a bit of context for that number, for voice feminization, we generally want to aim for somewhere between 1000 and 1500 hertz.
Okay.
1000 hertz is a relatively lower R1, so it's a value that'll be more associated with like, excuse me, with like a butch lesbian type voice, like a deeper voice.
Yeah.
And then 1500 will be more of a like a hyper feminine voice, so might be closer to like an anime voice, or I don't know, like a really like excited young girl type voice.
Yeah. By the end
so-
of it, I just end up sounding like from an anime. Oh no. It might be a bit too
I mean,
far.
I think it's fun and a reasonable goal to like aim for those high values.
Yeah.
Because the thing about this is, like, if you can aim for the high values, then you can do that when you're like really trying, but then you can relax into the lower values. So the higher your maximum is, the higher your relaxed one will also be. And the more you can relax for like a given value. So personally, like I can hit as high as like 1500, 16 or 1700 on a good day. But my resting voice, let's see, my resting voice right now is about 1050, and that's usually what I see. If I bring it up, if I talk up here, and by up here, I'm not talking about my pitch, I'm talking about my resonance.
Yeah.
Well, I sound more feminine. My resonance is about 1400, so it's 100 below that like upper range. So like 1000 to 1500, it's like rough values to aim for. They're kind of like benchmarks, but like it's okay to go higher, and you can get away with lower if you have like feminized everything else a lot. Then you can get away with like a lower R1. But it's easier to pass the higher your R1 is.
Makes sense, yeah.
Yeah. Yeah, so like here's like even more feminine. And like I doubt this would get gendered male, this voice that I'm doing right now, by like any reasonable person. And then like
and then this is what, like 700 hertz. So this is decidedly below that 1000 hertz target. Let's see if I can aim for like a medium value. So like,
what is that? Like, okay, so that's like 950. So this sounds more masculine. It also sounds like kind of butch.
And then this is like 850. So this is like decidedly masculine. So yeah, like the higher you are, the more feminine it'll sound. So let's try measuring. Gosh, I'm not used to talking around this resonance. This feels really weird. I normally just like super exaggerated and bring it all the way down, but then like talking around here, this is like really weird. Anyway, let's measure your donut. So whisper a gradual to E to
So to E to All right, and I'm like, when doing that, I just go from low to high, and I'll swap in between, or is it just
Let's measure your resting one right now, and then we'll do low, and then we'll do high.
okay? So just like a normal whisper slide that's resting.
Yeah.
Okay.
Yeah.
I don't know why I can't do it now. I guess I'm just embarrassed.
Oh, no worries. No worries.
Why can't I do it? I guess
Take all the time you need.
I guess because it's normally I immediately just keep going up, which is why I'm not used to just resting it low.
Okay, you can go up first. Let's do that. I think whatever's an easier starting point.
I'm trying to outdo E now. I guess I don't know if I did that right.
So I can't hear you right, or I can't hear the whisper parts. Could you turn on push to talk?
Yeah, I can do that. Let me get my mic closer too. That might help.
Oh yeah.
Voice, video, push to talk.
And by the way, Patricia in chat asks, "Do I need a tablet to download this app?" To download this app specifically, yes. To download a spectrogram, no. So I just posted links to a bunch of spectrogram apps in the in Event Text chat. The one that I'm using is Spectrogram Pro for iOS because I like it. Oh, nice. So that was very quiet, so I don't know if I'm reading the right line. The most prominent line is about 10:30. There's also a line at 1500, but I don't think it was 1500. And it's possible that the spectrogram is like faulty, and maybe it's a bit higher than that. I'm not really sure.
I actually probably download one on my own and like record whatever I pick up as well. And I can like post that in the channel, just kind of like messing around, see what I can get with it. I'd have to look up the ones you posted. You just posted them, didn't you? Yeah, there they are.
Yeah.
No, I'm so not used to push talk. Ah!
No worries. It's
There we go.
We need push to talk, but we don't enjoy using push to talk.
Even if I'm like this close. Did I pick it up at all?
It kind of cut in and out. Is that with
dang.
push to talk?
No, that was with that. I just want to test it one more time without it because I really don't like pushing it down. I'll put it back on.
Right. I wouldn't be surprised if my whispers got like cut off because I haven't used push to talk at all during this lesson.
Yeah, there were times where just like, I know what you're doing, but I can't hear it, so I'm just gonna.
Okay.
Yeah.
Okay. Yeah.
Yeah.
Yeah. And if that ever happens, feel free to like let me know, and I can turn on push to talk.
Okay, will do. Alright. So that was me trying to do like a resting low one, I guess.
Okay. That was about 1,000.
Okay.
So there I was hearing that E vowel again, and the E vowel has a relatively low R1, so you actually stayed at about 1,000 there.
Oh no. Alright.
Do you want to aim for or a? With a as in cat, it's easier to hit a high R1. With as in umbrella, it's easier to sound natural. So
okay.
It's fine to use either. Ziana basically says to use a for everything, which like works fine for most people. For me, it made me sound unnatural, and I was like really hyper focusing on that, so I like better. But a works fine for most people.
Okay, I'll keep that mental noted then. Oh wait, I'm sorry then. If I'm supposed to like, because I'm supposed to like do like a resting, then I go. Isn't like S supposed to let me go up and then I go back down to go back to A? Maybe I'm misunderstanding something. Because in order to do the donut, right, I was supposed to do like an ah and then a and then an ah. But if as
it's e for
e, that's where I'm getting mixed up then. All right, I want to try it one more time then.
Yeah, it's like if you're doing a karate chop and you're saying hi-ya. Hi-ya. There, little donut.
Oh, does that work?
I think that was about 10:30 again, but it's kind of a broken donut, so you cut off in the middle.
Okay, and that's me still using push to talk, so I guess it's just hard to pick up then.
Probably, yeah. Which is good. The quieter you're doing this, the less false fold engagement you have, which means the softer voice you end up with. So don't try to make the whispering louder. Just focus on like bringing the microphone closer and closer to your mouth, basically.
Yeah, I'm also recording this on my end, so I bet if I listen back, I'm going to hear all the ahs and e's clearly.
Oh, good.
Yeah.
Yeah.
Yeah, because one of the things I noticed after our first session was, like, there was no video footage, so I was like, oh, I'll just do that myself then next time.
Yeah. Okay, cool, yeah. Craig only records the audio.
Which makes sense, yeah. I don't know why I thought there would be video, and I was just like, oh, I'm such a fool. Because, like, there's a segment where it's like, it requires the video.
Right, yeah. At some point I want to switch from, like, Discord calls to, like, Skype or Google Hangouts. Because I think it's possible to like use Google Hangouts and like stream the conversation to like YouTube, which would be more accessible for more people, but it would also be like more technical burden and some other things. And I'd need to like make a YouTube channel and everything.
Well, it's not that hard, I would say, as long as you got a decent computer that can stream enough.
And hopefully an iPad can do this.
That I wouldn't know. So.
I don't know if my computer is decent enough, but I like being able to carry around my iPad and like shift my posture and things.
Yeah, I get you. Alright.
Guess I'll find out when I look into that.
Yeah, because the YouTube channel I have right now is literally just going to be nothing but these videos that I'm going to be recording for from our lessons.
Oh, nice.
Yeah.
Cool.
I fear to keep some kind of permanent documentation if I can. That's why I got my Discord that has a segment of it, and of course now YouTube.
Yeah, that makes sense.
Alright, shall I stop using Push to Dock? or is there anything else you want to try with the spectrogram?
Let's see. So you weren't going above about 10:30 on there when you were like even aiming for higher. So let's
yeah, which is a bit disappointing because it feels like there's a big difference between my low resting to where I'm like really trying to go high.
Yeah, so let's try to bring that up. So first, let's do some pa sounds and try to go as high as you can on the pa sounds.
Okay. Oh wait, I should not be as vocal with it. My bad.
That was pretty good, actually.
It's about the highest I can probably go with it.
Okay. Yeah, so try doing that followed by a whisper slide.
Okay.
Okay. I think you got to either 1500 or 1100 there,
Ooh.
and I feel like such a goof because I can't tell which, but regardless, that's an improvement.
Yeah, I'll take the lower number any day. Let's go.
Yeah. 1100 makes sense.
Yeah. And
but-
again, after doing the paw, I didn't have any phlegm while I was doing the slide. I don't know what the heck
Nice.
it's doing, but it's making it where it's clean. I like it.
Nice. Okay, let's do a whisper slide followed by an ah yeah, so that we can see where R1 is more easily.
Okay. So whisper slide, then yeah.
So pa pa pa, then whisper slide, then ah yeah.
Okay. I should be able to memorize all that. Yeah.
I think that was 1500.
Is it?
I don't. I think so.
You're getting me excited here.
Like the lower line is at 1,000, and that didn't sound like 1,000 to me. Let's try pa pa pa, and then like add voice at the end of that. So ha.
Okay, I can try that. Things like that I generally just drop instantly, but I'll try.
Right, yeah.
Oh, no, that was falsetto.
That's okay. That was a pretty bright falsetto, which is good. So yeah, keep trying with that.
Okay. Ooh. Ooh, that actually hurt a bit when I tried that one.
Oh no.
Yeah, it's okay though.
Okay, well, you're hitting good numbers with your resonance, I think. So translating that to voice is it seems to be the hard part for you, but
Yeah.
at least the first part seems to be working.
I'm glad. Any progression is progression. It's golden to me. So I'll take
Yeah,
whatever
yeah.
little I can get.
Yeah, absolutely. That's good because that's the right way to think about it. A lot of people get like discouraged because they don't reach some benchmark in some time frame, which is like understandable, but like
Yeah.
forward progress is good progress. If you're progressing, then that's the thing that matters. Okay, so we've got about 1 minute left.
Oh wow, an hour went by already.
Yeah. Do you have any questions?
At this moment, really no, because now I got so much to digest and practice on my own again. So
Okay,
it's
cool.
exciting.
All right. Does anybody listening have any questions? You can think of questions while I'm posting Craig links into Amelia's channel.
Watch this recording I did is now corrupted. I can
Oh,
feel
no.
it. I can feel all this being corrupted. I got my
No.
webcam on. I got my screening share. It's just like I got that feeling.
Well, if it is, then at least you still have the 2 audio recordings.
Yep, which is that's good enough in my book. But like especially for this session, having that
Yeah.
video would be really really nice.
Yeah. Well, like for any spectrogram stuff, you can generate a spectrogram from the audio. So
Oh,
it's-
okay, yeah.
Yeah, like even if you're just like playing the spectrogram and you've got like if you are you just playing the audio on your computer and you've got a spectrogram app running on your phone, you can just do that. And then if you're fancy about it, you can pipe the audio from the playing audio to a spectrogram program as you're listening, with just a computer. But yeah, so the spectrogram part doesn't matter as much, but the pointing at my throat part, like I try to narrate that as best I can so that people can understand it, like even if without the video recording of it. But yeah, spectrogram is pretty much fine if you don't have the video.
Awesome. Well, it's less of a hassle if I keep the video, but yeah, that's good to know at least.
Yeah, for sure.
That's good. I actually downloaded a Freecher, whatever's.
Oh yeah.
Not sure how to say
I
it.
usually say Fritcher, but
Freecher.
it's a French word. It doesn't matter.
Gotcha. So I'm gonna play with that later tonight. Once I get more
Nice.
water, because I am out and dehydrated.
Oh no. Yeah, definitely get lots of water. Speaking of which.
I think compared to like me 3 months ago, I'm drinking about 4 times the amount of water I normally do because of Spyro and of all the voice stuff I'm doing. So it's like
Spyro. Spyro is a heck. I was doing Spyro for several months, probably. I feel like maybe a year. I don't remember when I stopped Spyro. But I'm on patches, so with a high enough patches dose, you can pretty much stop Spyro and your testosterone will stay low. So that's the phase that I'm at. Yeah.
I didn't know that. I was just assuming you must have had surgery then if you weren't taking Spyro.
Let me boot Craig while I'm talking about illicit hormone stuff. Bye, Craig.
Bye, Craig.
Yeah, like so there's the approach that like most medical practitioners take when prescribing hormone stuff, which is like basically like an anti-androgen, and which anti-androgen you take depends on like what country you're in. So like in the US we usually do Spyro, and like in the UK I think they do like Cyproterone. I don't know how to pronounce it, but if you look at like what trans people have like concluded after like studying hormone stuff, it turns out if you take enough estrogen in a format where it bypasses the liver, and that means injections or patches, then if you're getting enough estrogen, then it'll block the testosterone by itself.
Okay.
And this is information that hasn't really made it into like the WPATH standards of care, which is what most like doctors use to prescribe hormones.
Yeah.
So it's not like standardized yet, but the science seems to suggest that, and like trans women's experiences doing what's called monotherapy seems to suggest that that you can just take estrogen and avoid the side effects of Spyro, which I personally hate. So
yeah. 'Cause I'm currently doing injections myself, so to hear that's interesting. I could talk to my doctor maybe about that. I'm not sure the volume of estradiol I'm taking. I know I'm doing half of what is it? Not a milliliter. I'm not sure what it is, but on the dial, so I go to 1, then I pull back to half, and that's my injection I take.
okay.
But this is my first. Like I haven't been re-prescribed or anything, so I'm pretty sure it's a low number anyway.
Right. Yeah. I think it really depends on the camera is off, by the way. I'm talking to my roomie who is camera shy. What was I saying? I think it your like blood test numbers will be what tells you whether you can like go off an anti-androgen, I think.
Fair enough. Yeah.
So I think like if you're hitting, I don't know, people give different answers on this. I think if you're hitting between 200 and 300 estrogen in your blood, then you can go off anti-androgens.
Okay.
Personally, I'm kind of like risking it. I don't know what my estrogen number is, but I'm on like a high. I'm on like a high enough like patch dose that I'm pretty sure it's above 200, and I don't like Spyro, so I just stopped taking it. Like I tapered off, and then like I haven't experienced any bad side effects, so I'm just
Gotcha.
sticking with it.
Yeah, I just looked up my my medication online, and I am taking I'm taking about half of 20 milligram, or it says half a milliliter, so 20 milligram every 2 weeks. So I don't know how much that is. It sounds like a lot, but maybe not.
Right.
Because most people who would talk about their estrogen is generally through the pills, and those are generally really low
Right.
numbers.
Right. Yeah. Yeah. I
Um,
think also like I feel like it's okay to like try tapering off your Spyro and see if there are any side effects you don't like. And if there are, then like resume Spyro maybe at a lower dose than what you're being prescribed. If you're being prescribed 200,
I'm being prescribed actually just 100 right now.
okay, that's that's a little better. That means you're not getting hit by as much of the unpleasant side effects.
Yeah, I
Like,
never got really hit with any side effects. So when my doctor asked me, it was like, I felt nothing for the past 2 weeks.
okay, okay, yeah. If it's not unpleasant, then it's not really something that you have to worry about.
Yeah.
Personally, like I hated having to pee so often and having to increase my salt intake, and like I was getting a lot of brain fog is like what really pushed me over the fence towards stopping Spyro.
Yeah. I know when I started my HRT, I actually grabbed Stress B complex, which gave me a lot of minerals and vitamins that I'm kind of pretty much missing out. Which apparently your B complex is like what helps you stay mentally like strong and focused. So I was just like, these are nice, and it also
Okay.
gives me biotin too, which is great for hair growth.
Oh, nice.
Yeah. I had to call my doctor though, because you always get the warnings like, don't mix this with this type of drug, and it's like, I don't know
Oh.
what HRT has, so let me just double check that.
Right, right. I should get going. If you want to learn more about like indie estrogen stuff, I guess, then I would look into Dr. Powers' work, Dr. William Powers. He's kind of the expert on like trans female HRT outside of what like WPATH recommends.
Gotcha. The name sounds familiar. I'm not sure where I heard it before.
He's got a lot of fangirls in
Gotcha.
trans spaces.
All right, fair enough. Well, thank you very much. I love these lessons.
You're welcome. Yay! I too love them.
I'm
You're
glad.
a fun student.
Yay! I'm glad.
Yeah.
All right. Well, time to get rendering on this and wait 48 hours before I can upload it because, yeah, videos kind of suck when it comes to uploading.
Oh gosh, yeah. All right. Bye.
Bye.